You know, throughout the show we talk about Medicare fraud and we talk about abuse. What is the definition between fraud and abuse, and how can a beneficiary be on the lookout, and how can they report either or?
Well, they can report either or by calling the Department of Insurance SHIP Division Monday through Friday from 8 until 5, 1-800-443-9354. We want you to understand that fraud actually occurs when an individual or an organization deliberately deceives others in order to gain unauthorized benefits. People don't open their Medicare statements with the frequency that they need to. You need to open those just like you do your bank account information or your credit card information. And these only come out once a quarter unless you sign up at mymedicare.gov to track your claims online. It's critically important that you keep a journal. We have those at the Department of Insurance at the SHIP Division. It actually involves something deliberate. So like somebody has deliberately stolen your Medicare identity number, because your Medicare identity number is your Social Security number or that of someone that you're drawing your benefits from. Abuse is perhaps the same charges showing over and over again that have been rendered against your account. And people say, well, you know, if I have a supplement or I have my original Medicare and there's no money out of my pocket, I really feel uncomfortable with maybe calling my doctor and calling their office on the task of something like that. But that's really wrong to do, because over $16 billion a year is lost in the federal taxpayers' money. All these people's money. It's just like having services rendered against your checking account or your charge account where services you didn't receive. You want to make sure that you understand that you did receive those services, and you also want to call it to task when you don't receive those services.
Sure. I mean, a kind of a concrete example. We don't know this happening in North Carolina, but we know it happening in other parts of the country. You're going to the mall, and someone's going to pay you for you to have a health care test. Now, we all know that is not real life.
Yeah.
You know, we pay the provider to have the test.
Or they say it's free.
Right, they say it's free.
And they want to see your Medicare card.
And it is the issue that Medicare beneficiaries do not watch those statements closely. You know, many times way after the fact, someone will say, well, you know, I had one a few years ago. There were these lists of doctors that I've never seen before on there. And you want to say, that's what we need to do to clean up Medicare fraud. You know, it may have been totally accidental. I mean, that's the whole thing of abuse. Abuse can be a human error that happens over and over again as well. But the idea is, and that's our goal in the SMP program and the SHIP program really as well, is to educate people how to do that process, how to keep those records, and to recognize and come to the consciousness that it's my duty as a citizen and as a beneficiary of Medicare to help preserve its integrity and you know, its honesty in paying claims. Medicare is happy to do that. You know, certainly we have watched the Medicare program grow immensely since 1965, starting out as our first stab in this country at a public health care system. And there are many, many benefits, but sometimes people become so casual with it. You know, our SHIP volunteers' worst nightmare is when you see someone walk through the door with a grocery bag full of envelopes, because you know it's someone who has never opened a statement. And, you know, the sad thing is that sometimes that would imply that they've overpaid their providers.
That's right.
Because they really don't see how Medicare has rendered the payment. But everybody can say, I recognize Dr. Jones because he's my family physician. Even if they don't understand all the money figures that follow it, you can at least identify, yes, I did see the doctor that day.